CWC or CDCA, you might see me abbreviate or say the word CWC, and that stands for the three testing agencies that came together. Last year was the first time that they were combined. So it stands for the CDCA, WREB, and CITA. Those three agencies come together. You might also hear us, let's call it the CITA exam, and we're just talking about the clinical board exam. So they do have an ADEX testing site, and it's on your Blackboard Clinic 2 site. There's a folder that says CWC on it, and go into there, and I have links to everything for ADEX testing. I have this website up there. I also have the forms for your test on there. I probably have a link to the dates of all the exams. But once you click on it, this is the actual main site, and you just choose the hygiene, so dental hygiene ADEX, so it'll come right here. It is a two-part exam, so there is an actual OSCE part, so the objective structured clinical examination that you're doing on a computer, and then there is the site, the clinical hands-on part of the exam as well. So both of those have to be taken for the CWC exam. If you get to their website here, if you scroll down just a little bit, you'll see all of the candidate manuals and forms. There's links right here to them. I also have links in your Blackboard site. With that being said, these are for the 2023. The 2024 manuals haven't come out yet. So everything we're going to be doing from on board, we're following the 2023 guidelines. We don't normally change, they might change like one little tiny thing. So we'll follow the 2023 manuals right now. Once the 24 manuals come out, I'll make sure and re-upload those and let you guys know if there's any updates. You'll also see the exam calendar, so you can decide where you want to take your exam. I'm going to scroll down. We have been approved for May 3rd and 4th. Here it is, University of Arkansas. It says Little Rock on there. It's a little confusing. It's not a Euler, but that is us, the University of Arkansas. We're going to be May 3rd and 4th. The Fort Smith people are taking theirs on May 1st, so that's why they have Little Rock up there, and then up here you'll see some of their Fort Smith. Right here. Yeah, here's Fort Smith. So we're 2 days after that. So here we go. So you can also click on the site information sheet. And this is what pulls up here. So I made this candidate guide handbook just for our site last year because we also accept outside candidates. So it could be you guys, it could be some people from another state coming in. It could be somebody that took the exam, let's see, a week or 2 minutes before and didn't pass. And so they have decided to take it at our site. So there could be some outside visitors there. You know everything that's in this manual. It's like telling you where our sterilization is and what products we have, and if they have to rent a Catatron, they pay $200, you know, anything like that. So I don't think you necessarily need to see this, but there is the candidate manual. I'm not sure why up here it says welcome to Utah College of Dental Hygiene, but it's obviously ours. So I'll have to let them know about that. Okay, so did everybody get to read the manual? Okay, good. If you highlighted, I'm going to go through the candidate guide first. I'm going to go through the candidate guide first and just kind of briefly mention important things about the candidate guide. If there's anything that you have highlighted or you have a question, when I'm in that area, just stop and ask me. I don't mind it at all. So please stop and ask me questions. Otherwise, I'm just going to keep talking. I don't know what questions you have. So please feel free. Because you know what? If you're thinking of a question, somebody else might be thinking it too. And maybe they didn't write it down or forgot or just didn't want to say it out loud. Okay. So the candidate guide here, one of the first things, and I've already said it, you need to know is it's two parts. Okay, we have the OSCE and then we have the clinical exam itself. It is the one agency. I talked to you about that. CDCA, WREB, and CITA all combined last year. There is a candidate portal. So this is where you're going to start your registration process. And I believe in your Blackboard site, I might even have a link to that portal. Hopefully it's still active. But the candidate portal is where you're going to start and you're going to begin and you're going to start entering all of your information, what school you're at, what date, what place you want to prefer to take it, and all of your information. You're going to pay for it. You're going to register for your OSCE. And that has to be at a Prometric site. So I think the one here in Little Rock is right across from the Heart Hospital. So right across the street from the Heart Hospital, there's a Community Center Drive, I think right in there. There's some buildings back there, and that's where I believe the OSCE is, if it's still, that's still where it is. But just know you can't register for the exams until you pay. Like, you can make your profile, but you can't select a date for either one of your exams until it's been paid for. You can pay with Visa and MasterCard. I usually get the question, when do we need to do this? I usually tell people that they can do it in January. January is really when I want you to start getting your candidate portal. I believe you're welcome to start doing it now if you'd like. With that, because we already have our date set for the Little Rock exam, but I'm not sure how far in advance they have their OSCE date set. So I usually tell people January, and usually you get, I don't know if you've gotten some money back from financial aid or over Christmas. That way you can just do it all paid for and all at once. But you do have to register through this portal. General eligibility, of course, you have to be going to a code-accredited institution, and Dr. Tucker and I have to approve you for the exam. So if you're not ready, we won't approve you. If you haven't passed the amount of competencies we feel like you should have passed at this time, we won't approve you to take the exam here. So it does, all candidate profiles have to go through Dr. Tucker and I, and we confirm them because we're going to see the name with the picture to make sure there's not cheating, things like that. I also have to see right-handed, left-handed, that kind of thing too, so we don't confirm anything before you can actually take the exam as well. You're not having to worry about the local anesthesia part of it. We can do respirations in Arkansas. I don't think anybody's an international student here, right? It is an anonymous exam. The graders don't see you, and you don't see the graders. The only people you see are the chief floor examiners. And so there's a chief floor examiner, and well, y'all are doing the simulated patient, so you're not even going to see this. But you'll see the chief floor examiner. Last year we had two. One lady had never been here before, so the other lady that always comes wanted to kind of help and train her and acquaint her with our site. You won't see this, Dr. Tucker and I, because we'll be hiding unless we have to strategically go to the bathroom on a different floor at the time your test is ending. You probably won't see us. Okay, so that's a hint. But everything is anonymous. They might go like, hey, it's 10:30. I go to the bathroom. On the fourth floor. Okay, candidate conduct. Okay, candidate conduct. Be professional. Any misconduct is not tolerated. With that being said, misconduct can't even be cell phone usage. No cell phones are allowed in the exam with you. No smartwatches. Okay, that's the same for the OSCE as well. That's going to be misconduct, so no cell phones. The chief floor examiners, they are actually pretty nice, I promise. They're really sweet people, everyone I've ever met. Sometimes they'll allow you to put some music on. A lot of times they just ask the sites what we allow, because they do want you to feel comfortable and feel at ease and not really so be nervous, that day. So, sometimes they'll allow you to put music on, but we can't have our cell phones going, we can't have our smartwatches on, and so be professional and remember to be, not cheating of any kind. You can't flip your shroud, with the shroud is the cheeks. You can't flip the shroud inside out, you can't take arches out, you can't unmount or dismount the tie it on. Everything has to be legitimate, like it was a real patient. You can't put your Cavitron on the chair. We got in trouble for that last year. Somebody moved the Cavitron, but if there was a patient there, it would be laying on their chest. So let's just act like everything is, it's a simulated patient. You don't have to worry about radiographs. Okay, so exam prep, there are video tools. So you'll see here, there's a YouTube channel and it has pretty good videos for you to kind of go through the whole testing process. And then the Q&A session. So generally a week or two, probably about 2 weeks prior to our May 3rd, 4th date, I have a date set with the CWC people and we have a whole webinar of question and answers. So, like I'm trying to do this with you here, this is going to be just like 2 weeks out with the actual CWC agency. If you have questions, ask them. Okay, so they'll answer anything you need to know. Timely arrival. So everybody knows how particular I am about timely arrival. They suggest that you get there 30 minutes prior to your exam. I suggest you get there in enough time to have a flat tire, change it, and still get there. Okay? I mean, it's a big deal. Okay? Leave in enough time to have a flat tire, change it, and still get there on time. Okay? So that's my thing. I'll be here at 5 a.m. I get here at 5. I don't sleep here, I promise. But I do get here at that time because I have to set up all the food for the examiners. We want them happy, right? We feed them breakfast. We don't want them to be hangry. But you guys are going to start trickling in at 6:30. So the first exam starts at 7, I believe. So we usually go in sessions. We usually have like 3 sessions going, and I'll show you kind of what that might look like. You are to arrive, and there'll be signs. There will be signs, so if you're not going to make a mistake, you can't come in the front door. And there will be a sign, no students beyond this point. Lines will be closed. You have to enter through the side door. When you go in the side door, you're going straight to student break room. And that's going to be the same for the mock courts. I know y'all probably just think I'm being anal, but I'm doing it so you guys can have the exact same, like know exactly what's going to happen. We've actually been commended several times for how well UAMS students knew the process of the exam. They're like, they knew exactly what to do. I'm like, well, we have a mock exam, and they're running loud in the front door. You know, we have to follow what's going to happen that day. We're going to simulate that. Okay, so we're leaving in enough time to have a flat tire. Infection control. So this is going to be site-specific, okay? Site-specific, but it's I want to say simulated patient exam, but we're still going to have our PPE on, okay? In the past, I don't care if you wear a lab coat, you know, with the simulated, we're not having a lab patient, but you still have to wear your eyewear, your mask, your gloves, everything that you have to wear for disinfecting the treatment area, all of that. So the PPE, you guys know where that is. Unless you're going to another site, you have to get with them. Is everybody planning on taking it here at UAMS? Okay. Okay. Remember, it's your exam. I can't tell you where to take it. Can't tell you how to take it. I mean, y'all are professionals now at this point. I can't tell you, I can't force you to read the manual, but I can advise you to read it several times. But you can choose where you take it if you'd like to go somewhere else. I suggest going to a place you're familiar with. You know the equipment, where everything's at. If you drop something, you know where more gauze is, and it's just an environment that you've been used to for the past 2 years. I took my exam in Springfield, Missouri, and I went up there a week in advance and had to tour the clinic and, okay, what chair am I gonna be sitting in? This one right here. Okay, how does this chair work? How do you do this? And, that's kind of a hassle, so I suggest you take it here, but I can't force you to take it from. We're not doing patient, PPE, barriers. You're still gonna use barriers. I would put like a barrier of plastic down because the water kind of gets a little bit crazy sometimes. They are going to have the slow speed saliva ejectors in the backside of the stroud. They kind of go in that rubber. That way, all the water's being accumulated and sucked out that way. Last year, the year before, actually past 2 years before, we did not have the face. But last year they did have a face, and some students were like, oh my God. I don't freak out about it. It's just, it's a mannequin Charlie. So like a Dexter for radiographs, it's still the same type of knot, but they have like a face to them. So I think they're clear. But we're still gonna use, barriers as necessary. You don't necessarily have to have the plastic barrier on your air water syringe. I mean, it is a typodon. I would put the black plastic over the chair because water kind of gets a little wonky sometimes. You still have to wear normal footwear and your uniform. I don't care what color scrubs you wear, but you have to wear scrubs, okay? And you still need to have, normal footwear on. I'm going to be giving you badges and labels for the mock exam, and they will as well. So you're going to have five labels. One label goes on your scrubs. One label goes on the gown that you're going to be wearing. One label goes on your taconite. One label goes on the baggie, and one label goes on your ACF one. Disinfect everything like normal when you're done. Okay, I think we're down to failure rules. 18-month rule. Okay, so you have 18 months to pass all parts of the exam. So the OSCE and the clinical part of the exam. So say you passed the OSCE, but you didn't pass the clinical part. You have 3 times to pass the clinical part in an 18-month span. If you fail at any part of the exam 3 times, then you have to start over and take them both again. Does that make sense? Questions so far? Nobody's explaining it. Okay. All right, y'all tell me. Y'all have. I don't foresee anybody failing it. Score results are generally released within 7 days. Sometimes they have they take your mandibles and grade them at another site, so it could take up to 3 weeks. But generally, I haven't seen that. They usually your exam is on Friday and Saturday. Scores are generally released on Monday. I think last year, they were released on Tuesday, something like that. So it's usually like 4 days. They don't usually make 7 to 3 weeks, but just so no, it could take up to that long. Appeals, you have 30 days to appeal if you don't agree with their decision. If you need special accommodations, you need to reach out to them in advance. Okay, you must have documentation for that. We don't need interpreters, we don't have live patients. I think you're going to pay through your candidate portal with the Visa and MasterCard. You can't register for the exam. You can go ahead and start your profile, but you can't register for a date until you pay for the exam. So you're going to do your profile, and then it takes probably 48 hours for them to send that information to me. So I have a login as well, and it's like a faculty login, and I see whenever you guys create your profile, and then I can go in there and approve. Really, it's your name matching your picture, your face, and then if you're right-handed, left-handed, type thing. So that I do have to approve that before you select the date. Okay. Yeah.
But then will it be on the website that you've approved it?
Yes.
Like, we'll be able to see it?
Yes, and that might take like 24 hours as well. So when I click approve, it might take 24 hours for you, but you'll know that I've approved you. Okay, yeah. Questions? Okay, so that was the candidate guide. Let's go over the simulated patient treatment clinical procedures. So this one's really, it's important, but this one's pretty important. This is what you're gonna follow the day of the exam. Of course, some of the stuff we've already gone over. It's an OSCE plus a clinical exam. Okay, the 2 parts. Many states require jurisprudence exam. Yes, we require a jurisprudence exam for your license as well, but it's not offered through the CWC. That's offered through the Arkansas State Board of Dental Examiners, okay? So you're gonna take a clinical OSCE, clinical practice, clinical exam, your jurisprudence exam, your national dental hygiene exam, the written exam, and then turn in your local stuff as well. There's lots of steps to get your license. I think you also have to be fingerprinted and another background check done. All that jurisprudence is not done through the CWC. It's super easy. Okay. Like ethics. Okay, not hard. Treatment goals. So the goals of this clinical exam is for you, one, they want to make sure that you know how to detect calculus, that you know how to remove calculus, that you can measure periodontal probe pockets accurately, and that you can manage the patient appropriately. That includes tissue management. If we find soft tissue management, you get points deducted. If you have major hard tissue damage, it's automatic go. Okay? All right, so soft tissue damage, like the gingiva is all torn up, like you went in there and just like went to town. Okay, they count off for that. Okay, in the guide it says exactly what is minor trauma and what's major trauma. Any major trauma is autofill.
Does that like typically happen? Like
minor trauma.
Okay.
Not, and it's like a point or 2. If there's 2 pieces, it's 3. If there's 3 pieces of minor, then it's autofill. 100 points off. So, yeah. I feel like you slice it off. Like, the little triangle, like you just slice that off. I mean, you don't
Has anybody done that in the past?
Huh?
Has anybody done that in the past?
Not major trauma. No. Like a point off for minor. Yeah. So, I mean, you don't do that in real life, right? I wouldn't foresee you doing it on your mannequin either. So don't stress yourself out about that. We already talked about the dates. Okay, here's examples of sessions. We never do 1 or 2. We usually do 3 in a day because a lot of y'all are a very large class, and we only I think run 11 or 12 chairs at a time. So this is going to be an example of 3 different groups. You might be in group 1, 2, or 3, or I guess A, B, or C. Group 1 starts at 7 a.m., which means they require you to be there by 6:30, which means Ms. Fitzy requires you to be there in enough time to get a flat tire and change it. Okay? All right? So, like, you're starting at that time. If you're in group 2, you're required to be there. It starts at 10:30, so you need to be there by 10. Does that make sense? And so it's kind of like a revolving day with like you guys coming and going, and then examiners pulling mandibles and putting new mandibles in and things like that. So it's kind of a process. You cannot say what day, like what time you want to go. Like you're just going to get chosen a time. Okay? So you might have your preference between, sites, LSU or here or Fort Smith or whatever, but in dates, but within that day, they're gonna assign you to group 1 or 2, group 3. They also do that strategically with, our left-handed students, and they assign people to certain groups. They rival, I don't know how many times I can say that. Candidate, be a professional. Infection control, it's site specific. We're gonna wear all of our PPE. I don't mind if you wear a normal gown or a lab coat, that's fine with me. I think that's how I did it last year. I'll just double check with Renee and Dr. Tucker just to make sure my memory's not failing me. Scoring system. You have to get a 75 or greater to pass the exam. Those scores are rounded. So on this page right here, this is the exact rubric. So you're gonna have, you start with basically like 0 points, and you earn points. So you're gonna have 4 teeth that you have to calculus detect. They're all gonna be on the maxillary arch. Okay, we'll give you 4 teeth, and it's gonna say, number 3. I don't know what it is, but mesial, distal, buccal, lingual, and it has yes, no, yes, no, yes, no, yes, no. So a no, hence, that's why I made the mannequin detection look that way. It's a little bit confusing, but that's what it's gonna be like on the exam. Of course, it's not gonna have 32 teeth there, so it might be a little easier to read, but you have to mark yes or no. If there's nothing marked, then you get a point off. Okay, so yes or no, is it there or is it not? Any calculus that's on a line angle is considered proximal. Okay? If it's a line angle, it's proximal. So you can get 16 points for that. The calculus removal is 66 points. So you're going to have 12 clickable subjungival pieces of calculus to remove. You'll know 10 of them. Okay? You'll know 10 of them. The other 2, you don't know where they are. And they are 5.5 points each. So for every one you miss, you get a minus 5.5 points. So if you get them all, you've earned all 66 points. That's great. It's in one quadrant, and it's going to be a lower quadrant. Question?
So the 10 they told you, there's this calculus here, no? It's like written, we have like a paper.
Yep. Candidate finding form. And I'll show you that. I have it. Yes. It's not the same pieces, right? Don't memorize it. Yes, it is exactly like that. Okay, so we got 66 points for calculus removal. You'll know 10 of the pieces. You won't know the other 2 pieces. Then we have 12 points for periodontal probing. You'll be asked to probe an anterior tooth and a posterior tooth, okay? And you're gonna do all 6 probe readings for that, okay? So that's your 12 points. You can be within 1 millimeter. You can be within 1 millimeter of the examiners. Final case presentation. If you have any remaining calculus on any surfaces, it's automatic minus 3 points. If you have calculus remaining on 2 or more surfaces, so if we see like flexive calculus, then it's minus 6 points if it's on 2 surfaces. Does that make sense? So it's like your final case presentation cleanup. Here is the soft tissue management. So 1 point deducted for each site of minor soft tissue damage up to 3 sites. The presence of 4 or more soft tissue damage sites will result in automatic failure. So minor soft tissue damage, there's slight soft tissue trauma that is inconsistent with the procedure itself. Minor soft tissue damage includes laceration, abrasions, less than 3 millimeters, laceration or injury that did not result in the need for suturing, periodontal packing, or further follow-up treatment. Does that help? Don't slice off and fill up, okay? Major soft tissue trauma is lacerations or abrasions greater than 3 millimeters, okay? So if you like nick, and it's less than 3 millimeters, that is just a minor soft tissue. So a result in the exposure of alveolar bone, flap, or amputation of the fibula. I don't think we've had any issues with that so far, so don't stress yourself out about it, okay? Hard tissue damage would be like a broken tooth, inconsistent with pre-existing conditions, or hard tissue surfaces that would require additional definitive treatment. So something that they would have to actually get restored. Okay. Instruments required, your ODU 1112 is required, a mirror is required, and it can be one surface or two surface. We have two surface mirrors. And then your UNC probe. We use UNC yellow, black, double probe. UNC probe has 1 millimeter increments. So that's all in your kit, so wouldn't worry about that. What I would worry about is if you haven't changed your end and it's worn off. That is one of the biggest pet peeves of the examiners. If they have a worn probe, they get angry. Okay? Don't make them ask for a different probe. Okay? Make sure the week before, all of our kits, we've changed our probe tips. Or we've looked to make sure that the black marks are still there, they're not worn off. You can, it is site specific, and I'll allow it on our site. You can use ultrasonics. So you can use the piezo or the Cavitron. Okay, you're supposed to rent them. If you guys break them, you buy them. Okay, just remember that. Anybody that's outside coming in does have to hand me a $200 check just to have it. I don't care which one you use. Okay, let me see. Dropped instrument protocol. I think I skipped that just a second ago. If you drop an instrument, you have to act like it's a real patient. So you have to stop and ask your chief floor examiner to get you another one, or Ms. Thompson if it's a Friday, or Saturday it might be a junior student that I might have here in the CA. Ask them to run and get it, okay? But you have to tell the chief floor examiner that you dropped an instrument, and they might set it aside, or you might push it aside, but you are not allowed to pick it up and keep moving. I know it's just a mannequin, but you can't, it has to be like it's a real patient. You cannot use that instrument. On the exam day, you have to bring in a government or school issued photo ID. So that could be this badge here, your driver's license, military ID, passport, but I have to see that before you can come in the exam. And so for mock boards as well. Practice bringing everything that you need that day, because I want you to already know how the exam flows. So you're gonna come in the side door, and once we get into the student break room, you're gonna have to show Ms. Thompson your government issued or school issued photo ID. Okay, once you have gone to registration, so registration is gonna be in the student break room. And you are gonna get paperwork, you're gonna get your baggie, you're gonna get your ACF form, and I'll show you that in just a second. You are going to get all of your ID labels, so we're not gonna have any names on them, even for our mock boards. I don't know whose is whose, but each unit is gonna have your number 333, okay? And so you're gonna have 5 badges that say number 333 on there. You're gonna put your badge on your scrubs, you're gonna put it on your gown or your lab coat, you're gonna put it on after you're done with your mandibular arch, after the chief floor examiner takes it out, you draw it off, you're gonna stick it to the bottom of your tampon, and you're gonna fold your ACF form and put that in your baggie, which also has a label on it. So everything you do has your label on it. And then it goes to the graders, and then they grade. They don't know your name, they know nothing about you, they're just grading number 333. You know, so that's kind of how it's gonna work. So once you're in the examination, once Ms. Thompson or the chief floor examiner says your registration is done, you've received all your labels, you got your form, you got your mandibular arch, they're gonna escort you to your operatory or let you know, or you're gonna know in advance what operatory you're going. And they're saying, okay, it's time. You go to your operatory, you're gonna set it up however you want to set it up. You're gonna put your mandibular arch in. Once mandibular arch is in, you can't remove it. and get it where you want it, lay it back, get your instruments out, everything that you feel like you need ready. Once you're ready, you're gonna come stand in the doorway. And so once all the candidates are in their doorways, then that's when the chief floor examiner says that you guys can begin. And you have to begin all together. You get 2 hours for everything. So your exam flow, once you've set everything up, you go to the doorway, CFE says it's time to start, you'll start the exam and you have 2 hours. First thing you're gonna do is calculus detect. Okay, so you're gonna do the calculus detection and you're gonna put it all down on your form. Let's see if I have. This is what the form looks like. And it'll say right up here what quadrant you're doing. If it's the lower right or the lower left. Please pay attention to that. Do not do the wrong quad. Okay? Do not do the wrong quad. It happens. Don't do the wrong quad. The chief floor examiner will initial here once they approve that your mandible has been mounted correctly. We will have, and they will have tooth numbers right here for you to calculus detect. So remember, you're gonna have 14. Yes, no, yes, no, yes, no, yes, no. You have to put something down. And then you're gonna have tooth number and surface here. So maybe this is 29D, 28M. Okay, it's gonna say that, but remember there's 2 more that you don't know about. Okay, those are worth 5.5 points each. So you detect, then you remove calculus, and then you probe. Okay, probing is last. You'll have an anterior or posterior tooth to probe, all surfaces. Ms. Thompson from Mock Boards will put your finish time here, and we'll mark off when the exam is completed. Yes, see where the candidate label also goes up there.
For the calculus removal, are we allowed to calculus detect before we do the removal?
Sure.
Or, okay, I didn't know
Yeah.
it was allowed.
You can do that, what's not allowed is polishing. Yeah, no polishing. That's a good question. Yes?
They have us write down like the 2 extra slots, like where they are.
No, they won't. They'll just know if you didn't remove it, then you get -5.5. That's 2, that's 11, so, but yeah, they're not gonna ask you where to go. Yeah. Do the whole part.
And I'm sure we can correct?
Well, they're not gonna trick you. They're not gonna put it in different quads. So if you're doing the lower right or the lower left, that's all you do. And that would be professional misconduct if you did the other side. Okay, don't touch anything outside of the treatment area or the teeth they tell you to detect or probe or remove calculus from.
So with the flow, like, say there was this calculus and you just like were really struggling with it and you're kind of getting close on time,
Stop and probe.
but you can't go back at it. You have extra time after probing.
That's fine.
Okay.
Yeah, that's fine. If you feel like you're gonna get warnings. You're gonna get a 1-hour warning and a 15-minute warning, I think. If it's 15 minutes and you haven't probed, stop and probe. Okay, get that done. But surely I don't think it'll take you that long. You're not having to nut. When we had live patients, numbing was part of the 2 hours. Yes.
How long does it usually take to do this on the Tappadon, like for the seniors last year? How long was the typical?
Majority of them finished earlier than 2 hours. I suggest you use your time. There were some people that got cocky, and well, I'm gonna do this in 45 minutes. It's just a time on it, and on their mock board exam got a 7%. Yeah, they passed, but that's a little too cutting it close. And we had people take their whole 2 hours, and we had to be like, okay, you done? And they got like 95s on their mock exam. So use your time wisely. You're not in a hurry. It's not gonna be like seriously tenacious. It's really finding the calculus. It's kind of hard to do.
You don't ever really talk to the examiner unless you need something, right? They don't walk in the room.
They will. They might walk in the room, she's not grading you though, she's not the grader, the graders are gonna be over in section A.
So really, you're just in there by yourself?
Yep. Just like, I mean, yeah. Chief floor examiners are really nice.
Are you?
Yes. Yes, she asked if you're allowed to have a second cassette. These are all good questions, so make sure we're listening. Yes, you're allowed to have a second cassette in case you drop something. But if you drop something, you still need to tell the CFP that you dropped something and you're gonna be pulling something from another cassette. I brought 2 cassettes to Missouri. I took 2 of everything because I was scared I was gonna drop something and then I didn't know where I was at, you know, all this. Me and Miss Turner and I both went, and we should have seen our bags. We had like 18 cartridges of Lidocaine. I mean, like we were gonna use that much Lidocaine. We got there, but you know, we were just prepared though, you know. Okay, so we know what this sheet looks like now, so let's continue on because I know you have class at 9:30. Setting up, checking in. I've already told you where your ID labels go. Mount the lower arch provided in the articulator and shroud. Set up your instruments. Here's the chair position you want to be in. Then you're going to stand in the doorway, and the examiner must check the position, make sure everything's good. You cannot turn your shroud inside out. You can't put the mount on upside down. Let's leave our piezo and Cavitron where they normally go, not sitting on the chair. You're gonna have a 1-hour warning, a 15-minute warning. Manage your time. And it's only the 1 quadrant, 14 to check, 2 period on the front. Okay, so you are gonna have, let me tell you 2 of the 12 surfaces. It's a little confusing. So you're gonna have 12 subgingival pieces of calculus in the quadrant. 8 are going to be posterior. At least 8 are posterior. 5 are interproximal posterior. 5 of those 8 are interproximal posterior, and 3 of those 5 are on molars. Okay? It's called the 3-5-8-12 rule. You're gonna have 12 pieces, 8 are in the posterior, 5 of those 8 are interproximal surfaces, and 3 of those 5 are on molars. Okay, does that make sense? So like 30 distal, 31 mesial and distal, that's 3 pieces interproximal on molars. Okay, so remember that 3-5-8-12 rule. At the end of your procedure, wipe down both of the arches with soap and water. I don't know why they have you do it with soap and water. It's a little bit sticky, but that's okay. So remove the lower arch. So let the CFP know that you're ready, and they'll come by and say, okay, remove the lower arch. So then you'll remove the lower arch. If you remove it before they come by, the exam is over. Okay? So remove it. At that point, you're going to blow it dry. Blow it dry. At that point, you can't touch any more instruments, but you can blow it dry, wipe it down with the soap and water, make sure it's nice and dry. You're going to blow out the maxillary one as well, because you're going to be getting water everywhere. So try to dry out the shroud as much as you can. You're going to put your candidate ID label on the arch. Place the arch in your plastic bag with the candidate ID label on it as well. And then your assignment candidate finding form, which is this one up here that we just looked at. Okay, you're going to place that form that has also a label on it. Fold that, put that in the baggie. Dry, and then clean up your operatory, gather all your belongings, and go to your checkout area. Checkout, again, is going to be in the student break room. And what they're going to do is they're going to look at your candidate finding form, and they're going to see what you put down, and they're going to put it in their iPad electronically. So number 3, you said it was on the mesial, and they'll confirm. Did you say it was on the mesial? And you're like, yep, okay, putting it on the mesial. You know, so they kind of transfer everything, and then they show you their iPad. They confirm that these are your answers that you wanted submitted, and then those get submitted. I'm not doing the iPad thing, sorry, I don't have their No, Max Lori stays there, don't touch, don't remove it,
How do they check to see if you
because it's standardized. They know it. So like our ones that we're doing calculus detection on, it's standardized, it can't be removed, it's not in calculus. They know what version you have in that room, and it's standardized. Don't be thinking that you can be saying, oh, you know, somebody that's in the second group, okay, we did this too, 3, 9, it's gonna be different for all the sessions, okay? You might get lower left, you might get lower right, or gonna give you different things. Okay, so, question?
So how does the, how does like the mountain in, how does it look for that comp part? Like, so we had that section for.
For doing the mock board, you can get signed off.
Okay.
Yeah. Doing the mock board, you get signed off, yes.
So the background.
Yes, they do. Yes. And your calculus could be on that.
I didn't hear what she said.
She asked if the tribe had third molars. They do. Yes.
So the OSCE that we go to, that is by the heart hospital, is that on a different day?
Yeah,
We do that?
it's on a different day. Yes, and a majority of people do it before their clinical, before their May 3rd one. You don't have to, it doesn't matter, I mean, you can do it after. But they usually do it pretty close. Please, I always have this issue every year. Candidates will, oh, I scheduled my OSCE during class time, we have an exam, can I get out? Like, you know when your exams are in class, come on, don't be scheduling it when you're in class, okay? Please don't do that. There's plenty of options. There's Saturday options, there's Friday afternoon options, you know, there's plenty of options. So get on there, and I don't know, that you could probably get on there now and look, there might be days. I'm not sure how far in advance they go, but yeah, don't do that, okay? I used to.
Another one that we.
It's like 100. I don't think it's that many.
I was gonna say, I know we did one last year, but.
For me, in pre-clinic, I want to say it's like 100, but don't quote me on that.
For the Oxford?
Yeah, I mean, it's not hard, but it's stuff that you should know from clinic. Kind of like when we did the pre-clinic one, which y'all were still a little bit blind.
Yeah.
But, you know, now you've learned so much. It's stuff that you should know. It's clinical, it's like theory stuff.
Is it all on the computer? Is it
Yeah.
last year we like went around and like,
No, it's on a computer.
it's just, yeah, we walked around and like copies.
Yeah. It's on the computer. It's kind of like case studies and things, you know, like you're gonna have to make decisions. Get online on the resource that says the YouTube channel, and it's gonna tell you about it. Yeah, it'll tell you more about it, so you can be more prepared for it. That's the one I wouldn't be that worried about, well, me saying that, please study. You know, don't make me keep my words here. Yeah.
So you think it would be okay to take the will be from them?
I mean, if it's like, right here, May, yeah, like right now, I'd probably do it that week, you know, before. Your exam is the 3rd and 4th, so maybe that week, or like the week after, so the week after is finals week. So you can't take it early, like, you're only taking March. You know, no, you need to wait.
You're talking about Austin?
Yeah. Don't be trying to take it March.
Do we do any like prepping for that in our class?
I mean, your national workforce will help with that, but again, it's like, clinical items, like theory would probably be the best prep for that. I haven't worried about that. I mean, people do pretty okay on that. I think I've seen one. do take the Tapon exam seriously. People have failed it, okay? People have failed it. So take it seriously. Calculus detection, if you haven't figured it out yet, it's a little different than you would in real clinic. You kind of have to put the explorer against the side of the tooth and kind of move apically, like run down the side of the tooth, instead of now you get below it and come up. It's slightly different. If you have not practiced in clinic yet, I suggest you do so real soon, because the first time you do it, you'll be surprised at how much you miss. And then once we mark yes, no, okay, go back and check these, or, oh wow, that was way down there. So take it seriously. That's easy 16 points. Easy 16 points. And people have failed by 1 point. So actually 74.5. And there's no rounding. So, did you have a question?
Yeah, when is usually the jurisprudence test? Or-
When do you take it?
Yeah,
In May. You have to go on the State Board of Dental Examiners website. I think Ms. Van has put together a PowerPoint on what to do, what procedures, because I think you have to go ahead and apply, and then they like send it to you. And I forget, it's been a long time. I did it at home, I remember.
I didn't know.
It's over the Dental Practice Act. So, know the Dental Practice Act. It's not hard. They wanna make sure that you know the laws work, that's all. It's different state to state. What else? Yes,
So for the national board, that May as well,
it will what?
the national board, they take it in May as well, or wait?
Most people do that after they finish, so like, after final week. Or in the beginning of May. It's usually in May, some people do it in June. Again, that's another one you have to be approved for. I believe you have to pass mock. Dr. Tucker does mock written exams, and you have to pass those before she'll do you that one. Yeah.
How long does it take to see your loss after you?
That's up for debate. It takes a little while.
What was the question?
How long does it take to get your license after you completed everything? And you turned everything in? No, I'd probably say like 4 weeks or so. I think most people usually get it by the middle of June, end of June. Yeah, middle to end of June. But that's if you're on it and you've already taken all your exams. Some people don't take their board exam or their OSCE until June or the end of May. So it might be July. It's like 4 to 6 weeks-ish.
this might be a dumb question, but after you pass all of your exams, like before you get like your license sent, are you able to start practicing
No.
or no?
No, you cannot practice until you have your license. No. Not at all. More questions? Yes.
As far as the like local, you won't get that certificate to like practice for a lot, right?
Not unless you do all your 30 injections now. So if you get your 30 injections, your 15 and 15 now, you can go ahead and apply for that when you apply for your RDH license. And you can get that, and it'll come at the same time, and you'll have it as soon as you have your RDH license. Some people don't finish their 15 and 15, so they'll go ahead and apply, turn in what they have done so far, and then the state board will send them a different form that they can have signed when they're out in practice. Say they needed 4 more. They have, their dentist can sign off on those 4, and then once that gets turned in, then they'll actually get the official local anesthesia license. Yes,
How much does it cost to sign up for the OSCE?
I think it's 1,200. I think it's 1,200 unless the price is changed.
That's for both.
Yeah, it's for both. Yeah, I think it's 1,200. I mean, it might have gone up, I don't know if it's 12, 14, but it's usually 1,200. I don't remember. I don't know.
Is it close?
No, like, it like 50.
Oh,
Yeah.
50, 70, I don't remember how much it was. I don't know if it's 50 or 75 or something, I don't remember, but it's not. Yes. Yeah. That portal is gonna be, that's the age.
And then turn.
Are there any more questions? I hear a dull roar now, so some people might